Hello, and welcome to this webinar on toileting titled Toilet Triumphs Learning One Step at a Time. Most of you are aware of the clinic Playful Strides Therapy. It provides occupational therapy and physical therapy services to children who are diagnosed with a variety of conditions. Its philosophy is grounded in respecting and valuing every child and family for who they are, and that the interventions are tailored to their unique strengths and challenges. We believe in following the child in trauma-informed practice, in family-centered care, and we want positive outcomes for all our clients. A little about me. I am a registered physiotherapist in Ontario, working with children who have special needs and their families. I believe that we need to support families in the development of their children by being their partners. The goals of today's course are understanding the preparatory skills or readiness required for toilet training, understanding how to begin toilet training, and dealing with challenges that may hinder toilet training. Most of the times, toilet training involves behavioral approaches and fails to highlight the motor and sensory challenges that may be impacting toilet training. And as PTs and OTs, we would like to bring that aspect of knowledge into the process of toilet training. The timeline for typical development of toilet training is as follows: daytime toilet trained by 36 months, bladder and bowel trained 24 to 48 months, nighttime bladder trained between 5 and 7 years of age. Please be aware that all of this data is collected with children who have no obvious neurodiverse challenges. They are neurotypical children, and even in that, you will realize that it is a very wide range of figures. So when we bring in challenges with sensory processing, motor challenges, emotional regulation, we are looking at a very, very wide spectrum of challenges that can affect and thus different timelines in which children might achieve their goal of toilet training. So we have to be very mindful of the data that we see, and we want to make sure that it reflects correctly on the population that we are working with. What are the factors that affect toilet independence? It's very important to understand that every bodily function is a very complex interaction between various systems. It's an important integration of our sensory systems, our motor systems, our cognitive systems, and our communication as well as emotional regulation systems. Every motor event is a sensory event first, and thus, if our sensory systems are not working to their optimal level, it may impact our motor output and it may impact emotional regulation as well as communication, which is why we have to be very mindful of the sensory systems that can be impacted in children who have neurodiversity. What are some of the sensory systems that we are looking at? We are looking at touch, vision, vestibular, proprioception, and interoception. How does touch impact toilet training? Touch is the first system to develop in utero and builds our connection with everything around us. So the cold floor of the toilet, the hardness of the toilet seat, the texture of toilet paper, all of this is important when it comes to toilet training. Vision, harsh lights, reflective surfaces, this can impact toilet training. The vestibular system, how do I feel in connection with gravity? Am I secure? Am I safe? When I sit with my feet off the ground in a toilet seat where my bottoms are not supported, how does that make me feel? Am I scared? Am I safe? Proprioception, they, how my muscles and joints provide information about my body and its relationship to space. How do I feel when I turn around and sit down and move in a backward direction to sit on the toilet seat? How do I feel when I have a toilet seat that's too high and I have to sit on it? Do I have enough motor planning to understand how I can bring that about? Interoception. Do I know when I have to pee or poo? Do I know whether I'm hungry? Can I differentiate between a feeling of hunger versus a feeling of pooping? What do I mean when I'm scared? My heart rate increases. What do I feel when I'm tired? All of these things are feelings of interoception. And most of the times, a lot of our children do not have the systems in place to understand these feelings and then connect them for a more functional purpose. And all of these systems will affect motor systems. It will affect how I move in space. It will affect how I understand my body in space. Most of our children have low functional muscle tone, which does not allow us to work effectively against gravity. And this impacts all of our posture and our alignment. And once it affects posture and alignment, it also impacts muscle strength. It impacts how the intra-abdominal pressures are formed. It impacts how our breathing is impacted. It impacts how GI motility is impacted. It impacts on every single system that is related to toileting independence. It also impacts balance and coordination when we want to step up on the stool, when we want to turn our body around on a small stool just so that we can sit effectively on the stool. Do I need my hands to support myself? What happens if I don't have my hands? Do I have enough central stability to support me on the toilet seat? So you can see that the sensory and the motor systems play a very important role in providing us with the, the background supports that are required for learning how to be on a toilet. Emotional regulation. If I am not safe in my environment, if I do not feel secure, if I'm always in a fight and flight response, this directly impacts my sympathetic system, thus takes away from the physiological function of toileting. I need to be very calm. I need to have a rest and digest system in place for my GI system to work effectively and then proceed with the toilet training. Anxiety can play a very important role in toileting independence. Communication skills. Do I have what it takes to let you know that I am hungry or that I'm having a feeling of fullness in my stomach, that I need to go to the bathroom, that I'm scared of the flush, that I don't want to go to the bathroom right now? Am I able to communicate all of these feelings with you? Or am I trying to give out signals that you can read easily? Am I able to provide that information to you in a small and easy manner that you can respond? Cognitive abilities. As we all know, that all of these systems in place will challenge our learning. And because we are challenged with learning, it will impact our cognitive skills as well. From a child's perspective, there are some things that we need to have in place to know that the child is ready for toilet training. These toilet training's readiness skills include motor skills, things like pulling down and pulling up pants with minimal assistance, imitating actions like sitting on the toilet, and understanding and following simple instructions related to toileting. We have to understand that even though we say pull down and pull up pants, this particular skill has a lot of depth in its learning and needs to be solved or learned in different levels. Someone might just learn how to pull up pants first. Someone might just learn how to pull down pants first. They may need assistance with the second half of the action. They may need a visual correlation between understanding what the verbal act of pulling down pants actually means. He may need some modeling before you teach them how pulling down pants works, right? So, even though it feels like a very simple activity, it takes a lot of learning from the child to understand what the verbal or visual cue of pulling down pants actually means. Does he have good shoulder strength and grip strength to effectively perform that action? Does he have trunk rotations to wipe his bum? When we say follow simple instructions, have we modeled it for him enough for him to be able to transfer that simple instruction to every single environment? When we say sit, does he understand that in every single environment, whether it's a toilet seat, whether it's a sofa, whether it's a table, whether it's a chair? Have we given him the skills ready to transfer those simple instructions into every single environment? Bathroom awareness. Does he know where the bathroom is? Does she show an interest in bathroom or toilet? Does he sit on a toilet without resistance and that there is no fear or aversion of the toilet? Sometimes children have challenges entering the toilet because of noise, smells, harsh lights. Do they feel comfortable in the toilet? Do they have any anxiety around the toilet? All of these things help a child to understand and develop secure connections with the toilet. And unless they have a secure connection with the place, it is very difficult for them to feel grounded and safe. Sometimes it may require that a child needs a story to let them know that peeing or pooing is a normal part of our daily life and that is where we do the act of peeing and pooing. So it is important for us to let them know through a social story or through a book that everybody goes to pee, everybody goes to poop, right? Do they have any sensory sensitivities? The noise of the flush, cold flow, texture of toilet paper. Are they interested to learn about the toilet? Do they go into the toilet to wash their hands? Do they explore flushing the toilet? Do they accept sitting on the toilet seat? Physiologically, two important things that we need for a child to be ready for toilet training. They should have regular formed bowel movements. They should stay dry for at least 2 hours during the day. What does this mean? If a child is having a regular diet with enough fiber, enough water, he should be able to process all of this diet into a formed bowel movement at least 1 to 2 times a day, right? And have it every single day. If he's doing this, this tells me that my GI system is functioning appropriately. If he's not passing bowel movements less than, and he does only 3 times a day, it means he's constipated. That means that we need to effectively prep the GI system to start working in an effective way so that we can start toiletry. Stay dry for at least 2 hours. Is his bladder big enough to hold urine for 2 hours? If he's going every hour, that means that his bladder is not yet big enough to store all the water, or he does not have enough control of the sphincter to hold it in for 2 hours, which means that he may not be ready for toilet training. What does parent readiness skills mean? When we start toilet training, if we have looked at the child to be ready, we also want to make sure that as caregivers we are ready. Do we have the ability to provide a consistent routine to our families? There are no major events happening, there are no major changes happening, and the child is secure and safe and is going to be able to follow a consistent schedule. I will be able to take him to the toilet at regular intervals. I will be able to support him during his meltdowns. I will be able to be there to co regulate him during periods of him being anxious or frustrated. Do I have the support of other caregivers? Is everybody on board? Are my teachers ready to support me in taking him or her to the toilet at regular intervals? Are my grandparents on board? Are my relatives on board? Will they be able to support the family in providing a consistent routine to the child in this process? Do I have appropriate equipment support ready? Loose clothes that can be easily pulled up, pulled down, communication aids either in the form of visual icons or a communication device like the iPad. Do I have a toilet seat that is small enough for my child? Do I have a stool for him or her to rest their feet on? All of these skills need to be in place before we actually start doing the toiletry. Most of the times, we tend to skip this particular path of toilet training, building connection and awareness. It is so important for us to build these connections and awareness over a period of time, even in spite of the fact that the child may seem ready for toilet training. Have you given them enough information about language, consistent language? What does be mean? What does poo mean? Have you provided them a social story about the origin of pee and poo? Have you given them information about the bodily function of peeing and pooing? Have they been able to understand the difference between wet and dry? Have they understood that poop goes into the bathroom and that it has to be flushed out? Have we encouraged diaper changes in the bathroom so that they are aware that the toilet is the place for doing pees and poos? Have we adapted to their sensory needs? Are we giving them a headphone if they're scared of the flush? Are we reducing the lights in the bathroom if they are too harsh? Are we giving them a pair of slippers so that their feet don't feel cold on the floor? Unless we build these connection and awareness strategies with our children, it is going to be very difficult for them to feel safe and secure in the process of toilet training. Again, we talked about the visuals. Are we using visuals that are effective? Some of the visuals that are already available show a child pulling down their pants and then sitting on the toilet seat and then getting up and pulling the pants. But there is no visual to talk to them about what happens when they're sitting on the toilet seat. It's just, so this is what the children will follow. They will pull down their pants, sit down on the toilet seat, and then stand up. So we need to build that awareness about what actually happens when we sit on the toilet seat. It may involve modeling by a parent, or it may involve a small video, or it may involve a social story. But it has to happen because the child is probably unaware of what to do when they're sitting on the toilet seat, right? Show how poo from the diaper. So sometimes we change them wherever they are, right? But it's important we take them to the bathroom, show them what a wet diaper feels like, show them how heavy it's become, or show them how poop looks in the diaper. Then show them how it goes into the potty and then how it can be flushed. We don't want to roll up the diaper and throw it in the trash just like that. We want to build that connection and that awareness. So these are some of the visuals that you can use. You don't have to use all of the visuals because it can become very overwhelming for them to see all of them at one go. So you want to start building them in steps. If you're working on only dressing and undressing, that's what you'll use. If you're only working on hand hygiene, that's what you will use. You can even use just one visual at a time to show them that this is what we are going to do. We are going to just sit on the toilet, even if it means with our clothes on. That's the only visual that you're going to use. So be very mindful of how many visuals you introduce to the child at a time. It's okay to let them sit on the potty in their diapers or with their clothes. It's absolutely fine. It is important for them to realize that we are meeting them where they are and not hurrying up the pace at all. Make sure that the toilet posture is appropriate. If it is too big, use a ring reducer. If their feet don't touch the floor, use a stool. If they have difficulty in turning around and climbing, use a bigger stool so that there is enough space for them to move and rest on the stool. Explore different bathrooms in the house or other environments. They get so used to using that particular skill in a particular environment, it is difficult for them to transfer the skill in another environment. So build connections about this is a toilet seat in our bathroom. This is a toilet seat in somebody else's bathroom. This is what the flush sounds like here. This is what the flush sounds like there. Make sure that you are giving them these small connections between a toilet seat that is similar in every bathroom, about a wash basin that's similar in every bathroom, about the process that we follow in every bathroom. So this is some of the things that we like to use. It has a ring reducer. It has a step ladder for the child to step up on and can even use his feet to support here. Posture, when we talk about posture, especially for pooping, we want to make sure that the knees are higher than the hips because this allows for good relaxation of the sphincter and easy passage of stools into the toilet seat. When it comes to peeing, we prefer the first posture, but the hips have to be hinging slightly forward, almost as if it's a pitcher that we are emptying, a pitcher of water into a glass. And which is why we want the bladder to be facing slightly anteriorly, so the whole body faces slightly anteriorly. So it's important to make sure that we have enough awareness of the different postures that are used for sitting on the toilet. After you've done all of this, you've built the connections, you've built the awareness. You know that your child is ready. What do you do? Most importantly, rule out medical challenges. It is so important to make sure that the act of toilet training is not impacted by conditions like constipation, GI disturbances like reflux. If a child is having reflux, it's very difficult for them to feel very safe and secure. It impacts entire breathing mechanics, and it impacts the central stability function, and it impacts pelvic floor work. Medications. Are there any medications that may be impacting a good bowel movement, right? So you want to make sure, and it is important to take the advice of a healthcare professional to rule out all of these medical challenges. We need to collect data. When does he or she go? Do they have a consistent routine? What does the stool look like? Is it hard? Is it soft? What is their fluid intake? What is their dietary intake? We need enough data to show us that they are staying dry 2 hours a day, their stools are not constipated, they are not hard or firm, and then we know that yes, they are ready to be toilet trained. Once we've analyzed this data, once we have our checklist for the children ready, parent readiness checklist is ready, and our support systems are ready, that's when we will start the process of toilet training. So this is the Bristol stool chart, and ideally you want to be in the type 3 and type 4 levels. Type 1 and type 2 usually means that the child is constipated. Type 3, type 4 is more a normal way that a bowel movement should look like. This is a wee and poo diary where you are noting down how much the child is drinking, what he's eating, how often he's going, and then this will give you an idea of whether or not he is ready and whether you can start. And it is always good to have a bladder and bowel diary even during the act of toilet training, right? It does not have to be done only previously because there may be so many factors that may affect toilet training, and thus you want to make sure that the routine that you are going to follow is maintained, and thus a toilet diary is always good to have even during the process of toileting. Now that you've collected all of these data, you're going to encourage, you know that a child is going to the bathroom at 10, at 12, you've seen that the diaper is wet. So you're going to encourage them to use the bathroom and sit on the toilet seat and try to complete a bladder movement. It does not have to be without the diaper, it can be with their diaper. It does not have to happen on the first go. They may just try to sit there for a few seconds, then pull up their diapers and leave. That's okay. But this is what we want to encourage. We want to encourage them to go to the bathroom, add those windows, and increase the sit time slowly till they are able to relax their sphincters on the toilet seat. We have to use consistent language to encourage them. It may be a good job, it may be a pat on the back, it may be just a hug, but we have to let them know that what they have done has been an amazing achievement. If for a bowel movement, if you are known that they have a bowel movement after they come from school, that's when you're going to encourage the bowel movements and you're going to take them to the bathroom, have them sit, even if it means in their diaper, increase those sit times a few minutes at a day, and then see that they will have the bowel movement on the toilet seat. Follow the same routine by then reading their cues and connecting it with the communication signal, whether it's verbal or visual. Now that the child is used to that routine, you have been taking him to the bathroom at the times when he's been peeing or pooing, you know that he's going to start associating these visits with the act of peeing and pooing. And over a period of time, it will become more easy for him to understand his bodily signals or a visual signal. It will be easy for us to read his signals and take him whenever he's ready, right? It is a good time to introduce potty training pants because they support the understanding of feeling wet or dry, and it will be easier for them to understand their cues and proceed to the bathroom. So if you think that the child is ready, then you can start using potty training pants, and this will help their transition to normal panties easily. So how do you increase sit times on the potty? There are a variety of ways, maybe reading a preferred book, maybe listening to music, maybe blowing bubbles, right? There are some times when an iPad could be important, but unfortunately, what happens is when we use the iPad, It takes away from the feeling or the understanding of voiding, and you want it to be a very conscious understanding of the feeling of what it feels like to void. So it is better to have these strategies in place rather than the use of the iPad, because it takes away from the conscious understanding of the act of being or being. Most of the times, toilet training can happen if we have all of these strategies in place. It is possible that we may face certain challenges. There may be toileting refusal, there may be stool withholding, which may lead to constipation or urinary tract infections. There could be the development of emotional issues like anxiety or fear, power struggles which cause frustration and negative experiences, and hiding to defecate. All of these things can happen for a variety of reasons, and it is our job as caregivers to become a detective and find out where it fell apart. Was it that the child was not ready? Was it that we read the signals wrong? Was it that we were too aggressive in our toilet training? Did we have all the supports in place from a sensory perspective that would make this transition easy? Was there something that we missed in our toilet training schedule that stopped the child from being more comfortable and secure? Was it too overwhelming? So the onus falls on us to become a detective and realize where the gap is, find the puzzle piece that's missing, and then work towards replacing that element that is missing. So, what are some of the sensory strategies that we can use? We've talked about this in detail. Reduce harshness of the lights, limit bright colors, provide alternative lighting. We've talked about visual schedules and social stories. We've talked about placement of mirrors. So we don't want to give, maybe sometimes a lot of mirrors can be very distracting for a child. Sometimes a mirror may make the room feel bigger. Noise reduction, headphones, counting down before we flush, recording the flush and making him listen to it. That can be a good way to help with sound desensitization. Or doing something else, playing a music while the flush is happening. All of these things can be different ways in which we can provide a sensory strategy to offset the challenges that we face from a sensory perspective. For texture, we use clothes that are easily removable, soft towels instead of toilet paper if it's too rough. Deep pressure while they're sitting on the toilet seat to give them the feeling of being safe and secure. Temperature of water. All of these things are so important in making the toileting training experience fruitful for your child and comfortable for your child. We have completed most of the aspects of this toilet training webinar. Just a disclaimer, all of the information that is mentioned here is a general information. It is only guidance. It is important. It is not replacing healthcare directions or personalized advice, which is why please do not hesitate to reach out to a medical professional for support regarding further toilet training.